Hello, everyone, and welcome. This is Michael Conley, CareerNet and Health Promotion Live. Today, we have a State of Wellness webinar with Jason Lang, the CDC Work and Health Program. Thanks for being here. Let me remind you that in the chat box is a code worth 25% off the optional purchase of continuing education. Totally up to you, no pressure. There you have it. And if you have questions during the webinar, go ahead and type them in when they occur to you into the chat box, and we'll get through as many of them as we can at the end.
Today we have Jason Lang. Jason is the team lead for workplace health programs, where he has managed projects and provided leadership for the CDC National Center for Chronic Disease Prevention's Workplace Health Initiative since 2007. His responsibilities include involvement in the CDC strategic planning around worksite health promotion, acting as a coordinator among NCC DPHP divisions, and liaison among CDC centers around workplace health, providing subject matter expertise to government and private sector partners, working on models of chronic disease program integration in the workplace, and working directly with the private sector to develop employer-based tools and resources for workplace health assessment, program development, and evaluation. He's a 1998 public health preventative, he's a graduate of the 1998 Public Health Preventative Service, a CDC postgraduate fellowship consisting of work at CDC headquarters and in the field. He was assigned to the Maryland Department of Health and Mental Hygiene in Baltimore. While in Maryland, Jason helped establish Maryland's comprehensive cancer and tobacco control programs, as well as organizing a statewide physical activity coalition. And he received his MPH and MS degrees from the University of Michigan in Ann Arbor. And we are really pleased to have him back today. Jason?
Thank you very much, Kelly. Thank you, Michaela. I appreciate you guys having me back. I think this is my third or fourth time participating in State of Wellness. So I'm always thankful for the opportunity and for the forum that you guys provide to get the message out about CDC workplace health tools and resources. And the one thing I have for everyone on the call today is a presentation about a new CDC program that we are currently beginning to roll out right now called Work at Health. It is a free employer-based training program around key concepts and fundamental principles related to building and maintaining science-based and effective comprehensive workplace health programs. The presentation today will cover an overview of Work at Health, how it's structured and how it will be delivered. I will talk about the three-legged stool of program components that focuses on formal training, technical assistance, and seed funding support, and then the overall program evaluation. Then describe for all of you the program eligibility requirements and how and where you can participate in Work at Health. And then lastly, show you a number of different ways you can receive information on the program or stay connected to what we will be doing over the next year or two. I'm sure most of you are familiar with the business case for worksite health promotion and protection programs. If you participated on any of these State of Wellness seminars in the past, you've probably gotten a lot of data and information on that. So I won't belabor that point and spend a lot of time on this, but we created Work at Health as an additional means of assisting employers in taking steps to improve the health and well-being of their employees, which in turn can save resources in healthcare or lost productivity costs for employers that ultimately can be redirected to more productive uses, such as raising wages marketing of an employer's products or services, or research and development for new products and services. Obviously, when we look at the trends in healthcare spending, it has been on a steady upward trajectory for a number of years. This goes both for the employer contribution to overall costs as well as individual employees and their families. So one way to mitigate this is to keep folks out of the healthcare system as much as possible and decrease their need for medical services. One way to accomplish this, and what we focus on in our workplace health programs, is to make the individual employee and their family as healthy as possible, particularly as it relates to chronic conditions like obesity or diabetes, which in many instances are the leading cost drivers for companies. Investing in employee health and well-being programs also provides employers and their employees with a number of other benefits that aren't just financial, particularly engagement of employees in the workforce, improving overall morale, overall job satisfaction, and making the employer a very visible source of leadership in their community to help with recruitment and retention efforts around making the employer an employer of choice. So when we look at Work at Health, as I mentioned, it's an employer-based training program. It's been funded through the Prevention and Public Health Fund of the Affordable Care Act. The focus will be on building employer knowledge and skill, as well as capacity, their employer capacity to implement, grow, and sustain workplace health promotion and protection programs. And for us at CDC, it's a new mechanism, new dissemination model to accelerate the adoption of science-based worksite health programs nationwide across the country. You may be familiar with the National Healthy Worksite Program, which CDC launched in 2011. It uses a lot of the same strategies, frameworks, and concepts, but this is focused much more on large-scale training activities rather than individual site-specific support to help employers build these type of comprehensive programs. And then at the end of the day, when we are done and as we move through this process, as we identify, develop best practices and models for practice, we will undoubtedly develop tools and resources that I maybe can come back in the future and talk to you all about and let you know where and how to access those types of things. Like all of our CDC program efforts, we're focused on building comprehensive workplace health programs, and by that we mean that employee health initiatives include multiple different interventions and intervention types, and that those interventions work synergistically or integrated with one another and operate all up and down the organization, from the individual frontline employee all the way up to and including the entire organization as a whole. They also can address multiple health risks and conditions, so they're not just siloed one-off type of activities, but look at the range of different health topics that might be of interest or concern to employers. We have two main contractors and partners who are working with us to provide the Work at Health program. The first on the implementation side of the house is Ashland Management Group, based out of Greenbelt, Maryland. They're primarily going to be responsible for developing and testing the training curricula, helping with the outreach and enrollment of employers, and then administering and managing the technical assistance and funding strategies and components of the program, which will move employer participants from the knowledge and skill they gain in the training and to the application of that knowledge and skill when we get into latter parts of the program. On the other side, we have RTI International. They are going to be our lead program evaluators. RTI is an independent nonprofit institute that provides research, development, and technical services to government and commercial clients worldwide. They'll be conducting both process and outcome evaluations focused on the employer participants in each of the different training models and methods that we have, and I'll explain a little bit more about what that means in a moment. Our overall evaluation objective is to gather both quantitative and qualitative data to comparatively evaluate the impact of different training methods and approaches on employer knowledge, skill, self-efficacy, and ultimately the adoption of workplace health programs, policies, and practices. The overarching goals for the Work at Health program are to increase employers' level of knowledge and awareness of key concepts and principles in this area, to increase the number of science-based programs, policies, and practices that are put into place as a result of the Workplace Health program for participants, to develop and promote a peer-to-peer, community-based employer learning network, and then for us at CDC, particularly to understand the training needs of employers and the best way to deliver skill-based training around workplace health programming to them. So as we go through the rest of the presentation today, I'll talk about how the different program components will be structured to achieve these goals. There are two basic ways to participate and get involved in the Work at Health program. The first is if you are an employer and you want to participate, the employer training is probably the one for you. This training is focused on knowledge and skill development and really also includes the transfer of that knowledge into action. So participants that go through the employer training will be exposed to formal training, and then through the technical assistance and funding components of the program will be able to take what they've learned and actually implement one or more evidence-based health promotion strategies in their work site, largely focused on chronic disease issues, but not exclusively focused on them. If you're not an employer, but you work with employers, if you're a health department, if you're a business coalition, a nonprofit organization in the community, a trade association, or something similar, and you work with employers on workplace health issues, the Train the Trainer curricula may be the one for you. And here we'll follow a similar model in terms of the three-legged stool: training, technical assistance, and funding support. But the outcomes that we're looking for graduates here is to take the knowledge they gain in how to deliver the Work at Health program and rather than implement interventions at their work site, to go out and train other employers using the Work at Health curriculum. At the end of the day, we're looking to have over 1,000 employers participate directly or indirectly in the Work at Health program. For the employer training, we will engage and recruit up to 480 employers, and then we will put them into one of 3 different training models: an online model, a hands-on model, and a blended model that includes elements of the online and hands-on training. Each employer that participates is able to send up to 2 participants within their organization to actually come to the trainings, participate in the technical assistance opportunities. So you take that 480 employers and can double the number of participants that we will accommodate. For the Train the Trainer arm of the program, an additional 120 participants will be able to participate there. And as I mentioned, their requirement will focus on training additional employers after they go through the program We're looking for 5 additional employers to be trained by each graduate of the Train the Trainer curricula, which would potentially expose the program to an additional 600 employers. Just for your information, this is kind of how we're organizing and classifying the size and sectors of the employer participants that we'll have. Will range from very small employers with 20 to 50 employees all the way up to and including anybody. So there is no ceiling level for employer participation, which is a little different from our prior program, the National Healthy Worksite program, where we capped participation at about 1,000 full-time employees. This is only really important in terms of how we want to organize the overall population of participants, as well as some of the eligibility requirements and some of the seed funding levels that will be utilized in the program. Work at Health is, we hope, much more than just sitting in a class listening to an instructor. The formal training that we will have will be supplemented with a rich set of technical assistance activities and seed funding to support employer implementation of effective workplace health strategies. The creation and integration of a peer learning network will also assist participants in problem solving and overcoming barriers to building or enhancing their workplace health program. So I think of this as a 3-legged stool with all of these components of the program working together to really deliver the content to participants. So the next couple of slides will take a closer look at each of these components, and I'll talk about any differences between the employer training arm and the Train the Trainer arm of the program. If you are an employer and you are going into the employer training, what you will receive includes no cost to you to participate in the training. You'll conduct and complete an organizational health and safety assessment. This will look at your existing capacity and your existing needs. We're going to be using the CDC Worksite Health Scorecard, which some of you may be familiar with, to get the majority of this organizational assessment data. You'll have access to expert technical assistance and consultation. In terms of the seed funding levels, depending on your size again, you'll be eligible to receive up to $5,000 to work on active implementation of strategies. You'll have the opportunity to participate in the peer learning network, and at the end of the program, you'll be recognized for the good works that you've been doing over the last 8, 10, or 12 months. I mentioned briefly that the employer has a couple of different training modalities that we'll be using. Regardless of the training modality that the participant is assigned to, the curricula will be the same for all participants. So one arm of the program will be for participants that will get the training through an online method. This will include seminars, case studies, demonstrations, and other things such as webinars that will all be delivered on a distance-based e-learning platform. We'll have a hands-on model where the participants there will be a part of interactive workshops that will provide the content through lectures and case studies and group work, but that will all be done in an in-person setting where people will come to the same location, work with their instructor and their subject matter expert team to get the training. And then the blended model involves a combination of both distance-based e-learning from the online model as well as in-person classroom sessions with the hands-on model. Again, all participants will be exposed to the same curricula, and all participants will also have their training facilitated by a team of instructors, facilitators, subject matter experts, and/or online coaches. The curricula that we're using in the employer arm looks like this. It's an 8-module curricula, and starts with kind of leadership and engagement strategies and moves people through a developmental process of understanding what's going on in their program, building and planning a program, actually implementing strategies, and then evaluating those strategies after they've been implemented. The approximate training time, we think, for the employer curricula, somewhere between 10 and 12 hours based off of our pilot testing that we did last fall. But it really depends probably on the different training modality that you get assigned to. For the hands-on model, that will be a 1-day workshop. So you're probably much closer to the lower estimate of the time commitment in terms of the formal training, somewhere around the 8 to 10 hour mark. If you are assigned to the online version, you'll have a number of weeks to go in and do the training at your own pace, which for some folks may take less time, for other folks may take more time. After you complete the core training, or a participant completes the core training, they'll move into the technical assistance phase. That will facilitate them taking action, in which case we mean implementing one or more science-based health promotion strategies. Throughout the technical assistance phase, participants will have access to their instructors and subject matter experts who will guide them through the 4 basic developmental stages of whatever intervention they are focused on implementing. And that's represented on the right side of the screen here, starting with assessment and going through evaluation. The technical assistance itself is going to be delivered through a very dynamic online peer learning network that will make available a number of different and diverse technical assistance opportunities and channels for employers, participants to take advantage of. You'll see at the bottom of the slide 2 boxes, one a structured technical assistance box and an organic technical assistance box. Some of the technical assistance that will be available to participants will be structured, organized, and led by our workplace health team. This is what we mean by the structured technical assistance component. That will include things like webinars or real-time video conferences. The organic technical assistance will really allow participants to organize and communicate amongst themselves, really take the bull by the horns and maximize the amount of engagement they want to have across themselves. And we'll have a number of tools to help support them doing this: social media tools, virtual teams, instant messaging, and things of that nature. So I'm really excited about the technical assistance part of the program and think it will really be a very nice extension of the formal training that participants have. One thing you will find with Work at Health as you move through the program is there's going to be some repetition in the key concepts and principles that are discussed. It's really the nature of education. Most of us probably need to hear things a few different times before it's fully comprehended and we can really apply that knowledge. So the technical assistance part of Work at Health will be a continuation of the formal curricula, and we hope will accomplish 2 objectives for us. One is full comprehension of knowledge. We found during the pilot testing of the program that there is a lot of material to cover and that the pace of the training moves pretty quickly. And so the TA sessions that follow a month or 2 after the formal training will really allow participants to have time to digest the information that they received during the formal training and then have it followed up on and reinforced through the technical assistance package. The second objective is really in the application of knowledge. Our goal with Work at Health, again, is not just to share knowledge, but to have that knowledge used by employer participants to improve their workplace health programs. So the technical assistance sessions are structured to align with the different core training modules, again, so those key concepts can be reinforced, but also allow for a deeper dive and a more applied look at how to maximize use of those concepts and facilitate that employer action. So the TA, again, is an extension of the training, not just a rehash of what was learned in the training course. The last leg of the three-legged stool, if you will, is the funding support. I think I've mentioned a couple times, depending on your size, an employer can receive up to $5,000, and we really see this funding support, although it's modest, to be able to serve as a catalyst for taking action by offsetting the cost of implementing one or more interventions. And the interventions we'll recommend to people, and the coaches and our instructors will recommend to people, really largely come, again, from the organizational CDC Worksite Health scorecard assessment that we have. As you can see here, the funds are tied, the release of the funds are tied to specific milestones that relate to different program development phases, starting with assessment and moving through evaluation. Those are logical and sequential and chronological in order, and again, they align with how the curricula has been developed and how the technical assistance schedule will be implemented. So if you wanted to look at this in practice, like what would an example be of a participant? So let's say we have a small employer, they have 50 employees, they apply for Work at Health and they're selected and they go through the training and, you know, understand that where they have a gap and potentially some interest is around physical activity promotion. So they decide they want to focus on implementing some environmental support interventions to create, you know, more access and opportunity for on-site physical activity for their employees. So through Work at Health, they would start with an assessment process. Either what data do they currently have or what would they need to help support a plan around one or more environmental support interventions for physical activity. Let's say, for the sake of this example, they wanted to do a short survey to understand specifically what employees would be interested in around physical activity. They take that information, they develop a very brief proposal and plan for how they were going to address it, what they would want to implement to address it. They choose to focus on walking trails. So as they move from that assessment into their plan, into the active implementation of a walking trail, they would have these different milestones completed and have funds released to them to be able to support them taking action there. Moving now on to the certified trainer, train the trainer arm. This, again, will be no-cost professional training provided to participants. The focus here will be on the knowledge and skills necessary to deliver the Work at Health program curricula. So while participants will be exposed to and asked to become familiar with the employer curricula, the focus will really be on facilitation and training skills that they can then apply to deliver that training to others. They will also have the opportunity for seed funding. The difference here being, again, we're not focused like employers on implementing workplace health program strategies, but focused on supporting participants to be able to train other employers. They too, through the peer learning network, will be exposed to tools and resources and professionals and experts, and also at the end of the program will be recognized for their efforts. Another difference between the two arms is while the employer group will be able to send up to 2 representatives to training or to participate in Work at Health, those selected with the train the trainer arm, we will have one opportunity for one person from a given organization to participate. Talked again about how this train the trainer arm may be of interest to organizations that work with employers around workplace health promotion protection activities, so a health department, business coalition, trade association, or nonprofit group. The curricula for the training, again, a little different here, again, because the focus is on developing training and facilitation skills rather than understanding what's in the curricula itself and being able to apply what's in the curricula. So we have 6 modules instead of 8. However, because the participants here will have to deliver work at health, there is probably a little more total training time involved with the T3 group because of that added step of becoming familiar with the workplace or work at health curricula. TA, again, will be structured the same. We'll have both directed and organic technical assistance opportunities. It'll be done through the same platform, peer learning network, but you'll see in the right, instead of that milestone process, beginning with assessment and going through evaluation, because the focus is again on training other employers, the milestones the train the trainer group will be tied to revolve around planning and preparation for their training, actually delivering the training, and then after the training's been completed, a debriefing and lessons learned session. Funding support, also again structured very similarly, tied to different milestones and phases. Unlike the employer funding, which is a little bit dependent on the size of the employer participant, everyone in the train the trainer model will be eligible for the same amount of funding, up to $2,500. Also, because the train the trainer program requires a face-to-face component to it, we recognize there may be some travel issues for participants who reside outside of our training locations, and I'll talk to you in a moment about where those are. So we will allow some of this seed funding to be used for participants to actually participate in their training, not the training that they're delivering to other employers. This isn't so much an issue for the employer training because of the online version that we will offer. So if there are travel restrictions or barriers for the employer participants, one way that we can overcome that is to assign them to the online version, which they will be able to complete anywhere. Just before I move into the eligibility and application process, a couple more things on the technical assistance package. You know, really, again, we hope this is going to be a very robust platform that's going to allow access to a number of different materials and tools and resources, both, you know, print and hard copy kind of resources, as well as professional resources for people, subject matter experts and others. And that those resources are going to kind of range across the spectrum from very localized things that can be accessed only in your town, in your community, all the way up to things that, you know, are shared across the board, across the country. And all of that's going to be done through this online peer learning network. Here's just a screenshot of what that's going to look like. Things that it's going to include are obviously the training, formal training modules. We'll have our additional webinars housed there, and then you'll see from the next slide some of the ways that participants can access either smaller groups of employers, colleagues, subject matter experts, other participants through different social media, different instant messaging or communication channels. And we really hope this, at the end of the day, allows them to share information for problem solving or troubleshooting purposes, to create their own professional networks, as well as to be a communication tool to let everyone involved in the program know what's going on, what's new and exciting, if we have something that's been developed, to be able to share that quickly with everyone. As I mentioned earlier with the program evaluation, we're going to be focused on knowledge changes and the resultant actions that are taken from those knowledge changes, which will be implementing programs, policies, and practices in the work site, and comparatively evaluating the online, hands-on, and blended models of the program to see which are most effective and which might have an impact on the long-term sustainability of this type of training program. So hopefully you're now interested in Work at Health, and you're wondering, well, how do I go about getting involved here? These are the 2014 training dates and locations that we have. We've spread them out around the country. We'll be starting in Baltimore, Maryland in the middle part of March, and moving through and around the country to the West Coast, the San Francisco Bay Area, down in the Southeast Atlanta, where I'm located, and ending up at the end of May in Chicago, Illinois. You can see from this slide that the online training will begin several weeks before the in-person trainings, whether they be the hands-on model, the blended model, or the T3 train the trainer model. This is to accommodate the online requirements that the folks in the blended and train the trainer models will have to accomplish prior to their in-person workshop that they will have. You'll also see that the online model folks will have somewhere between 2.5, and 3 weeks to be able to go through the entire 8-module employer curriculum. If you look at the eligibility requirements for folks interested in the employer training, there aren't many, but they are listed here. We do not have a ceiling, as I mentioned, on the size of employer that can participate in Work at Health. You can be any size as long as you have a minimum of 20 full-time employees. Another key requirement is the ability to have internet connectivity for the training participants. Hopefully you've seen through both the online training model as well as the technical assistance and peer learning network that the ability to get online and access that information is going to be vital for people who are participating in Work at Health. And the curriculum itself is based at a very high basic or low intermediate level of knowledge. So we're principally looking for people who have fairly minimal experience with workplace health programs, certainly not organizations that might have been doing this for 10 or 20 years. Having said that, the comprehensive approach that we'll be delivering sometimes is a very novel approach for employers, even if they have been doing wellness activities for a long, long time. So that may factor into someone's decision-making if they would like to participate or not. For the Train the Trainer group, again, different program, different focus, so different eligibility requirements. Basically, what we're looking for folks here is that they have at least a year of prior experience in terms of implementing or managing a workplace health program, and that level of experience it goes hand in hand with background knowledge they have around many of the key concepts and fundamental principles that we talk about in the curricula. So they can either demonstrate that they have that prior knowledge in terms of a certification or a degree that they have, or they can go through the curricula itself prior to beginning the training and get that level of specific knowledge that is the focus of Work at Health. And to help document that process, we'll ask folks in the Train the Trainer application process to provide a letter of support or recommendation from their employer or an organization that they've worked with around their implementation and management of a program. Here's a link where you can actually go to get the application. Put a screenshot on here, what the first page of it looks like. Shouldn't take more than 10, 20 minutes maximum to go through the questions and apply for the program. As we get those applications in, we'll begin to review them and I'll talk to you in a minute about some of the different program mix that we're looking for to ensure that we have a diverse group of employers with respect to size, industry type, and where they're located. We will be recruiting and selecting employers on a rotating basis. So our first training is in Baltimore, Maryland, so that has the closest registration deadline, application deadline, which is coming up in a couple of weeks here. As we move through the different training locations, the application deadline for those groups will close in early to late March. So it may be easiest for a participant to participate in the location that's closest to them. However, there's no restriction for us in terms of a participant who wants to go visit a different training location, spend a couple days there on training, and then return to where they live. Our goal will be to ensure roughly equal numbers of participants for each of the training models. So in order to be able to compare the experiences of the online participants with those in the blended model, for example, we want to have roughly equal numbers that are participating in both those. So we will, in the application process, ask applicants for their preference in one or more of the training models. For some, it may be an issue. For others, they may not care which one they get assigned to, and we will strongly look at that preference. But because we have a goal of having to have basically equal numbers in the different models, we will be striving for that, which may not always be able to accommodate the modality preference that people have. The other big requirement that we will have as a program is really to focus on serving the small and mid-sized employer group. We've set ourselves a benchmark of 75% of all participants, so that roughly 480 number of employers be coming from the small and mid-sized employer categories. So again, we don't have a ceiling on the size of an employer that can participate, but we'll only have about 25% of the total participants that will be considered our large or very large employers. And then once the application process is over, the applicant will be notified as to their status, and if they're accepted into the program, be assigned to their instructor and start the training program. This is just a slide real quick to show you kind of how things will be organized on the ground when we go out into the field with this. The training location and training dates you saw occurred over a 3-day period. Each of the days is really dedicated to one of the different training modalities, whether it's the hands-on model, the blended model, or the T3 train the trainer model. Participants in those 3 in-person models will work with a team of instructors and subject matter experts, and it'll be organized in groups roughly of 12 to 15 participants. The online part of it will happen again several weeks before the in-person parts happen, and this is the approach that we'll follow basically for all 4 of our regional training locations. If you look at the timeline, we are right now in the recruitment and application process. The entire Work at Health program, at least this initial offering of it, will last from now through the middle part of 2015. The formal training is going to take place beginning in March and concluding at the end of May. Roughly a month or so after the formal training is done, the technical assistance and funding pieces will begin. Those will run throughout the remainder of 2014, and then with some follow-up in the early part of 2015. And then with respect to our program evaluation, so looking at those pre-post assessments for the organizational level activities or changes in knowledge and attitudes and behaviors, it'll be sprinkled throughout the process, survey here and activity there. We'll start that during this application and recruitment phase, and we'll follow up and be completed with all of that during the summer months of 2015. If you look at the approximate time commitments we've been asked from a number of interested people at this point, how much time would this really include? And please look at this slide and recognize this is just an estimate on our part at this point in time, particularly with things like the technical assistance provisions. It's really going to be what the participant makes out of it. So the more they participate, obviously the more time it will take. But we're estimating for the employer training about 10 to 12 hours of formal training, 20 to 40 hours in the technical assistance phase, and then about 5 hours devoted to evaluation. Now this is spread out again over a period of about 15 or 16 months. So when you look at, the per month time commitment, it's about an hour or two per month. On the train-the-trainer side, as I mentioned, a little bit more time involved in the formal training process because of the need to become familiar with the Work and Health employer curricula, but roughly the same amount of time for both the technical assistance and evaluation provisions. Here's our program website. This is where we'll make announcements. You can obviously see the big green buttons for how to apply for either the employer training or the train-the-trainer training. You can also subscribe through the program website to our Gov delivery mechanism, which will instantly notify you when we have added any content to the program website. We have a program mailbox if you'd like to send us directly a message or question. And one thing you might be interested in sending through that mailbox is a request to get on our constant contact list. If you do that, my recommendation would be sending an email to the email address here, workathealth@cdc.gov, with workathealthcc in the subject line. We'll have you added to that constant contact list, and you can also receive program communications going forward that way. So Michaela, that is all I have for people today, and I will turn it back over to you in the remaining time we have for any questions.
Awesome. Well, good job. That was a lot of information that you burned through pretty darn quickly. We do have a bunch of questions. Some of them, you kind of answered, but I think it's probably just a good idea to, be sure. First one from Rhonda, wondering, can an employer, after taking the employer training, get involved in the train-the-trainer program?
Yeah, they are going to run, concurrently with one another, so I think it would be very difficult for an individual person. Mm-hmm. So you, Rhonda, in particular, to do both of the programs. Now, having said that, a couple of thoughts. One, it is possible you could send different participants, different individuals to participate, one for the train-the-trainer program, one for the employer training. So that's one option. The other is to look at which your organization would be best suited with to start, either the employer or the train-the-trainer, and look for future offerings of Work at Health. I think one thing we are thinking of doing at this point is, obviously, we want to make this initial offering to people. We want to evaluate it. We want to learn from it. But we are very focused on sustainability of the program over time. So while I do not know exactly how this might look in the future, my hope is that we will have future offerings of Work at Health moving into 2015 and beyond.
Super. Okay, from Leslie. Do you plan on implementing or providing a benchmarking opportunity for employers participating in the program?
Benchmarking opportunity for who? I missed.
I'm sorry, for the employers that are participating in the program.
Yeah, one thing we are doing, as I mentioned, with Work at Health, and what we've also done with the National Healthy Worksite program is use that CDC Worksite Health Scorecard as the baseline and post-assessment instrument. We are going to have a lot of information, obviously, from both those programs in terms of the employers and where they stand with respect to all the different interventions that are included in that scorecard. And so one thing we'll be doing is building that database of employers and their practices and programs and policies, and be able to share with not only participants in these programs, but more broadly what employers are doing in terms of their practice out there. So I would say yes, there would be an opportunity to benchmark, at least against these other participants in these programs, with respect to what they're doing in all the different things the scorecard covers.
Great. Okay, Adele is wondering what type of funding mechanism will be used for TA funding, grants, whatever. I think she's kind of confused. Is the funding is the funding for employers, or is there funding available for the trainers?
I would think both funding, whether you're in the employer arm or the trainer arm, will be done through a mechanism between Ashland and the organization rather than the individual participant. Mm-hmm. Because the participant technically on the employer side is the employer, that makes sense for that agreement to be made there. And then on the trainer side, because one of the requirements is to kind of have organizational support for your participation in that program, again, I would assume that would be that arrangement would be made between the organization and Ashland Management, which is our implementation contractor.
Super. All righty. Kelly asks a very good question. Good idea. Good question, Kelly. For those employers being trained by the Train the Trainers, I guess the graduates of the Train the Trainer program, will they also be eligible for that funding?
So you're talking the, if I understand right, the Train the Trainer person who goes through Work at Health, mm-hmm. then they train 5 employers. Are those 5 employers eligible for the funding? Is that what you're asking, Kelly?
Yes, that is what she's asking.
Okay, that's what I thought. It wasn't clear about this, but the funding, again, as I mentioned, for the employer training is really to be that catalyst for employers to take action. And they will go through not only the formal training, but then all of the technical assistance opportunities to help position them and support them to take that action. Where things differ with the graduates of the Train the Trainer program, the certified trainers, is they only progress their employer participants, those 5 employers, through the formal training portion of the program. This is done for a number of reasons: timeline, how much time we have, total funding we have for the program, things like that. So because that requirement's not really set up for them to progress through all of those technical assistance requirements, and where that funding gets introduced, the $2,500 that people get for the Train the Trainer is really for the sole purpose of just going through the process of developing and hosting a training for the employers, and then at the end of that, using the same evaluation instruments that we have in terms of evaluating the training and the job that the certified trainer did with those program participants, those other 5 employers.
Okay. Let's see. Diane is wondering, and I'm betting I know the answer to this, so I can't wait to see if I'm right. Can an employer who participated in the National Healthy Worksite program apply for Work at Health?
I think it's one of the same responses that I gave with, can you do the employer and the train the trainer program the same? And that part of the answer, I think, is that's a lot on any individual's plate, and I probably would not recommend that. The other thing is that those programs they're different. They're complementary, as I mentioned. They're based on the same framework and the same guiding principles. But they are very different. National Healthy Worksite is a very on-site supported type of program. This will be much more distance-based. We obviously did not establish any regional training locations that were in our National Healthy Worksite program communities because basically we are looking to expand our reach and offer these mechanisms to additional employers. And then the last thing I would say is that from a strategic planning look here at CDC, we're looking to understand the differences in employer adoption of the same types of programs and practices based on these different kind of dissemination and delivery models. One, again, with National Healthy Worksite, very intense on-site program. Work at Health, more distance-based, more hands-off kind of approach, more focused on training, one less focused on training. So to not bias those different samples, it probably would not be appropriate for someone at NHWP to participate, at least at this point, in Work at Health.
Yeah, I would imagine that could really cause your head to pop right off your shoulders. A couple different questions, just generally wondering about if you get the training, whether you do the trainer or you, I guess, get the training directly as an employer. If you wanted to go out and deliver this training, could you charge for it?
Yeah, we've gotten some of those questions too. We are beginning to think about that and put together some plans for 2015 and beyond. One thing that I think is kind of holding us back at this point is to understand exactly what the program looks like, how it works, how it operates, how effective it is. Again, some of those larger program evaluation questions. And because we haven't delivered the training yet, or the TA, or the funding and everything else, it's a little premature to say exactly, okay, Work at Health going forward is going to look like this or is going to look like that. So until we can kind of process all of that and understand and make any recommendations or changes to what we're doing here initially, can't really speak about how it's going to look in round 2 or round 10 or going forward. So the best way I can answer that right now is we have been starting to think about that because it is a very real question, but I do think it's a little premature to have an example or a answer to exactly how it's going to look moving into next year and beyond.